In episode 3 of our Patient Rights series, we're talking about the right to choose a physician to manage a patient's care while on hospice. You're listening to Heartbeat from the Heart of Hospice. I'm Jerry Finter, here with Helen Bauer.
Whether you're a family caregiver or an end-of-life professional, we're here to enhance your hospice experience by connecting you with information you can use about end-of-life care. Because we know how busy life can get, Heartbeat is designed to give you helpful information in a bite-sized format.
This is now number 3 in our series on patient rights. Last week, we talked about the right to complain, the right to make a complaint.
That's my favorite. No, I mean, that's the most important one.
Right. So if you missed that one, you just do a rewind, go back to last week's and listen to episode 2, where we talked about the right to voice concerns and not be discriminated against for doing so. In episode 3, we're going to talk about the patient right to choose a physician. So let's talk about this in a little more detail and explain what this right really involves.
So remember, this is listed as part of federal regulation. Not only did the patient or responsible party have the right to choose a physician, the hospice agency has to tell them and has to respect those rights. So it's important to know that they can choose what we call an attending physician in hospice. An attending physician, which means this is the doctor that's going to manage all your care. Okay.
So there's an attending physician, but there's also a hospice medical director.
Right. You can have both. So say if you've been being treated by your family physician and you would prefer that he continue to be part of your care along with the hospice medical director, you can ask your physician, or the agency will ask your physician, would you like to continue to follow this patient? They would like you to continue the care. And the physician may say no, but that is entirely up to them, right? There's great continuity when you have your attending physician, someone who knows you and has been involved in your care. The important thing to know as a hospice professional is that you can't circumvent that physician. You are not supposed to. It is in the regulations that if there is an attending physician that is willing to stay on and the patient chooses that person as their attending, then the hospice agency has to respect that and work to communicate and coordinate care with that attending physician.
Right. So there's a lot of nuances to this particular area because you have an attending physician that would be the patient's choice. You have a medical director, a hospice medical director, who's also involved in the patient's care.
Right.
So sometimes a physician will choose not to follow the patient, and they have that right.
And for a lot of different reasons.
Okay, so why would a physician choose not to follow?
A physician can choose not to follow because it's not his or her area of expertise, not his skill set. And so maybe that physician isn't comfortable with symptom management and the medications that we typically use towards end of life, and may feel that the patient's care would be better served by the hospice medical director.
Right, which makes sense.
And I think a challenge that we face when it comes to choosing an attending physician is you may have 5 doctors if you have a complicated set of diagnoses. You may have an oncologist, you may have a neurologist, a nephrologist, an endocrinologist, a pulmonologist, and maybe you see 4 or 5 of those people. So which one is your primary? Which one would you want to be your attending physician when you're on hospice? So I think sometimes that's a little bit confusing and it can get complicated, and patients would like simplicity. The hospice medical director, if they choose the hospice medical director to be their attending physician, it's a one-stop shop. But if there is an attending physician that is not the hospice medical director, that hospice agency has to work with them.
When you're planning your next event, keep in mind that the hosts of the Heart of Hospice podcast are available to speak at conferences and meetings. Whether you're meeting in person or virtually, we can provide education to your team on topics such as how to have compassionate conversations, how to recognize personal bias, building listening skills, and managing personal grief as a hospice professional. We'd love to encourage your team and remind them why the work they do is so important. Because we both have a personal hospice journey in addition to our years working in end-of-life care, we can also share a message of resilience and hope at your agency's next memorial service. To find out more, contact us at host@theheartofhospice.com. We'd love to be a part of your hospice journey. Now, back to today's episode. So I don't want to muddy the waters anymore here.
Yeah,
but
it gets complicated, I think.
It can, but a nurse practitioner can also act as the patient's attending physician.
Yes. So a lot of times you may have a physician that is your primary doctor, right? That does most of your care, but the person you see is the nurse practitioner attached to that practice, right? This is the person who really knows you, has been the one-on-one care provider for you, and you would like that nurse practitioner to be your attending. Yes, that is acceptable. That is in compliance with the regulations.
Right. And so just to be honest, many times it is the nurse practitioner that you see more often than even the physician.
Sure. Now, the nurse practitioner still functions under the supervision of the physician, right? But in this particular case, the nurse practitioner would collaborate with the hospice team and the hospice medical director to provide care for the patient.
Right.
And really, that's all the patient and the family, the caregivers need to know.
So it's good for you to know as a patient or a caregiver, a family member, that you can choose your own attending physician. If you have a physician that you are really comfortable with and you want that physician to continue following the care for you or your loved one, you can do that. That's your right to do that. Again, it always depends on whether the physician will actually choose to do that also. They have the right to say yes or no to that. So those attending physicians will then work in collaboration with the hospice team and the hospice medical director to provide care for the patient.
Thanks for listening to Heartbeat from the Heart of Hospice. I'm Helen Bauer here with Jerry Finter. Because we know your hospice journey is 24/7, you can always find us at theheartofhospice.com. Subscribe to the podcast wherever you're listening, and take a minute to leave a rating or a review on Apple Podcasts.
It's easy to connect with us. You can just send us an email to host@theheartofhospice.com, and we would love to hear from you. You can also find us on social media. And remember, no matter who you are, or where you are in your hospice journey, you are the heart of hospice.